Our first video will show how to transfer a patient from bed to wheelchair. The second video will be how to transfer a patient from the wheelchair back to the bed. Our patient is Mrs. Eda Monroe. She is a 75-year-old female who tripped over a cat and fell, breaking her right hip. She was admitted to the hospital and had a total hip replacement, posterior lateral approach, the next morning. She has a Foley catheter, IV in the dorsum of her left wrist, and is weight-bearing as tolerated. The PTA will be assisting her from supine to bed sitting, stand, pivot to sit into the wheelchair with moderate assistance. Her precautions are no crossing the right leg over midline, no hip flexion past 90 degrees, and no internal rotation of her hip.
Good morning, Miss Monroe.
Hi.
How are you doing today?
I'm good, so tired.
My name is Sarah. I'm a student physical therapist assistant. And your therapist has asked me to come in today to work with you with some bedside sitting into your wheelchair, and then we're going to work on your wheelchair back to the bed also, okay? You okay with that?
Yes, ma'am.
Okay.
All right, first the PTA will set the wheelchair next to the bed. She'll place a pillow on the seat of the wheelchair in order to help the patient with comfort and leaning back for hip precautions. She'll set the caster wheels forward, lock the wheels, and remove the legs. Next, she will place the catheter bag on the side of the wheelchair. Check the patient for no-slip socks. And place the gait belt onto the patient for safety.
All right, Miss Monroe. Let me go ahead and walk you through what we're going to do today.
Yes, ma'am.
Like I said, we're going to work on sitting up, and then with that, we have a few precautions that you can't do while we do that motion, okay? Go ahead and take your sheet down. Before I go through those, we're going to go ahead and get this gait belt on you for safety, okay? All right, can you prop up on your elbows for me? All right, stay right there. I'm going to come around you and put the gait belt on. Okay, go ahead and relax. I want this nice and snug. All right, so the first thing, like I said, we're going to work on sitting on the edge of the bed. There's a few things that we're not going to be able to do with this right hip since you had your surgery though, okay?
Okay.
First thing is we don't want these right toes to go inward towards your left foot. Okay, so we want to try to keep those straight up or just a little bit pointed to the outside to the right. Next precaution is we don't want this right leg to come over the midline, which means we don't want it to come toward your left leg any. Okay, I'm going to try to keep that one out. And lastly, we don't want your hip to bend up to 90-degree angle like that.
Okay.
So with all those precautions, I'll help you, assist you with that with your legs. So we make sure we don't cross those parameters.
Okay.
And I'm going to get you first to prop up on your elbows again. All right, so I'm going to support your legs the whole time, okay?
Okay.
You worry about scooting your upper body for me, okay? What I'm first going to do is get you to move to your left, just so we can get you to the side of the bed. Stay leaning back for me.
Like that.
Like that. Okay. Now we're going to go with your upper body towards the right.
Okay.
Use the elbows. Again, relax your feet. I'm going to control your feet. And remember to stay leaning back. And let me know if you hurt or if you need a rest.
Okay. I'm gonna rest for a second.
Okay. Now go ahead and bend your left knee. Let that leg relax. I'm going to support this one.
I'm ready.
Then you let me know when you're ready. Ready? Continue to scoot. Stay leaning back. Good. All right. Go ahead and stop right there. I'm going to go ahead and bend this knee.
Okay.
All right. And let me drop your bed down just a little bit. Okay. That's as low as it goes, so we'll go from there. All right. The next thing we're going to do, I'm going to support your legs again right behind your knee here. I'm not going to pull on them. I'm just going to lift them up. Now, what I want you to do is use your elbows and your hands to bring yourself forward towards me.
Okay.
Okay? So when you're ready, I'm going to just support these legs so we can bring them closer off of the bed. Don't want to cause any pain though, okay? Keep it toes outward. All right, go ahead and stop right there. Now the next thing we're going to do is be sitting in the wheelchair. We don't want to lean that body forward too much, okay? Remember that 90-degree angle we want to avoid. So what I'm going to do is I'm going to come here. I'm going to get you to press with your elbows and your hands, your left foot, and then your right foot as much as you can without any pain occurring, okay?
Okay.
So we're going to weight bear is tolerated on that right foot. All right, so are you ready?
Yes, ma'am.
Okay. So on 3, remember to stay leaning back, okay? 1, 2, 3. Come up, stay back, good. You okay?
Okay.
Okay? All right, I'm gonna sit you back down for a second. Lean back. All right, good. Can you rest on your elbows for me?
Yes, ma'am.
We don't want your IV to get caught, so what I'm gonna do is come around.
That would have been bad.
That would have been very bad. Don't want that to happen. All right. That way you got a little rest in there.
Yes, ma'am. I'm ready to go.
All right, so now we're gonna try it again. All right. All right, you ready?
Mhm.
Same procedure as last time.
Okay.
1, 2, 3, push, stay leaning back. Good. All right, now I want you to pivot towards your left, towards me. And when we go to sit down, again, lean back as far as you can. We want to sit back in that pillow.
Okay.
All right, you ready? 1. Reach back for those handrails with your hands for support. Good. And sit on 3. 1, 2, 3. Back as much as possible.
Ooh, that's a workout.